Today we're going to talk about heart rate. The purpose of this video is to give you some tools to help you find and measure your own heart rate. We're going to be talking about why this is important for determining your specific heart rate maximum and how to measure exercise intensities based off of that number. One important thing to note is that certain medications like beta blockers, which may be taken for certain heart conditions, can have an effect on heart rate. That means that you'll need to find a different method for figuring out the intensity of your workouts. Let's get started. Make sure that you have a clock nearby. We're going to begin with how to find your pulse to measure your resting heart rate. Go ahead and find a comfortable position and take some deep, relaxing breaths. Let your heart beat slow and let yourself get into a nice, steady breathing pattern. Avoid doing this immediately after exercise or if you've been feeling stressed. When you are nice and rested, gently place your pointer and middle fingers on the inside of your opposite wrist, like where you would wear a wristwatch strap. Lightly move your fingers to the thumb side of the wrist and press down firmly. You should feel a little beat under your fingertips. This is what we call your radial pulse. Make sure that you're not pressing too hard, or you can close off the vessel, making that pulse harder to find. You'll know that you're in the correct place when you feel a repeated, rhythmic, soft beat. Pay attention to the beat and start counting the pulse rate. Do this for 1 minute. The number you come up with is your resting heart rate. Normal resting heart rates range from 60 to 100 beats per minute for healthy adults. This norm number may fluctuate for younger children and older adults. If you're having difficulty with finding the pulse on your wrist, you can try finding it on your neck. To do this, place your 2 fingers under your jawbone. Slide your fingers down your neck and towards your windpipe to find the carotid pulse. You can use either the radial or carotid pulse to measure your heart rate. We're now going to shift our focus to finding your heart rate maximum or heart rate max. This number is the best way to figure out the intensity of your exercises. If you have had or currently have a history of heart problems or other cardiovascular conditions like high blood pressure, make sure to contact your physician for guidance prior to starting a new exercise regimen. You may need something more specific to determine safe ranges, or you might need to go after different targets than what we're going to be talking about. There are some special multi-stage tests that we can use to calculate an individual's specific heart rate maximum. At an exercise testing site, we're going to use a simple math formula. Heart rate max equals 220 minus your age. Go ahead and calculate your heart rate maximum by subtracting your age from 220. This is going to be the maximal heart rate that your body would reach at high intensity workouts. Now, this is not a perfect method, and your actual heart rate maximum during vigorous activity may fluctuate 10 to 15 beats above or below this depending on your age. This is, however, a great place to start. Now that you've found your heart rate max, we're going to use it to help you calculate your goal heart rate for low, moderate, and high intensity exercises. Now, again, remember, if you have a history of cardiovascular conditions, check in with your physician to make sure that your exercise heart rate and target intensity are right for you, because this might not be the right method. For low intensity, we're looking at 40 to 50% of heart rate max. Moderate intensity is 50 to 70% of heart rate max, and high intensity is 70 to 90% of heart rate max. So why does this matter? Based on something called the overload principle, your body elicits a conditioning response generally at 60 to 90% of your heart rate max. If you're a healthy young individual, 70% of that heart rate maximum is the minimum needed to build your body's fitness level. If you haven't had a chance to exercise in a while, or you're an older adult, for example, you may only need to exercise at 40 to 50% of that heart rate max to get the physiological response when you first start out. Thanks for listening and engaging with me during this informational video. Please contact Back in Step PT with any concerns or questions because we are here for you.